would be a high-risk pregnancy because of my diabetes and my age and a history of fibroids. And so it was important to me to have a healthcare specialist who knew about high-risk pregnancy and those factors. And that's when I found Dr. Anu's video and was just very impressed by her ability to address those issues professionally and compassionately. And so I decided that this was the best place for me to have the baby.
This patient has 3 risk factors. One, she's an elderly primary gravida. Anyone who's above 37 years, we call them as elderly primary gravida. The second is she's undergone a previous myomectomy. And the third is a badly controlled diabetic. When she came to me, she was almost around 26 to 28 weeks pregnant with not well controlled sugars. She was getting almost about 100 units of insulin.
I wasn't under any special medication for the fibroids. I was taking basic medication for the diabetes.
Once she came to us, then we had to take some time with our endocrinology team to get all the sugars under control. And after the sugars were under control, she was under regular checkups with me. We had planned a cesarean for her at 37 weeks itself, at the completion of 37 weeks, because of her history of previous myomectomy. Whenever a patient has myomectomy previously, there is that chance of rupture of the uterus that can happen during pregnancy anytime. So we just wait for the baby to become mature, and then we go ahead and deliver these patients by cesarean.
I was also concerned about the complications that come with fibroids because I knew that hemorrhaging might be a possibility, or not the fetus not going full term. So those are all possibilities. So of course I was nervous about that.
So with all these problems, she was continuously under my care. We monitored her sugars, we got her sugars under control, fairly good control. The scans were done, the baby was growing well. One of the problems with diabetes is that you can have macrosomic babies. When we say macrosomic, that means they are very large babies. These large babies are not healthy large, they are unhealthy large. Whenever diabetic women deliver unhealthy large babies, these babies will require prolonged NICU care.
I'm familiar with India and the culture and had visited hospitals. I'd never, of course, had any treatment in India, but I knew that Bangalore and Fortis in particular would be cutting edge. They would have the best trained staff, the best facilities and equipment. So I had no doubts about the quality of that care. I think I just had apprehensions about how different the care might be, if they would have enough time or be able to answer all my questions.
These sort of patients should not deliver in standalone obstetric units. They have to deliver in a hospital which has a good backup in the form of other disciplines being practiced, a good anesthesia team, a backup of a blood bank, and very important is the neonatal ICU.
So when we had the baby through the C-section delivery at Fortis Hospital, it went so smoothly. We couldn't have scripted it, better, because Dr. Anu was there to explain every step, what was happening. The anesthesiologist was extremely kind, and the staff is just remarkable. They have many nurses who were very attentive and never made me feel at all ill at ease. And so I would say that the experience of being there, I was there for 4 days because it was a C-section, was really positive, and I felt as though, again, the care was as good or better than what I could have had in the US.
Especially in the last few weeks, her sugars were very well controlled, and the baby was almost normal weight, around 2.8 or 2.9 kgs. Once it was born, the sugars were well maintained and the baby stayed with the mother. It never required NICU care.
As a foreign patient, one of my concerns was whether or not I would have access to the doctor and could visit regularly, and in case complications came up before the pregnancy, what level of access would we have? And I was really pleased that we were able to go almost on a weekly basis, and there was never a time at all where we felt that we were inconveniencing the staff or Dr. Anu. In fact, the liaison who coordinates our program, the package we selected, was exceptionally helpful, even to the point of having questions about where to find things in Bangalore when the baby was born. She was helping us with that. So we were delighted with her openness and willingness to be so available. And that, again, just built my confidence level in the services that were provided. We can't speak highly enough about that aspect of the program. It was really positive and made us feel really welcomed and special. We felt as though we really mattered. We weren't just one number, we really mattered. So that was nice.
It is very important that women who have had a history of myomectomy or who are elderly primigravidas or known diabetics, they come and visit the gynecologist even before the pregnancy happens. We call this as pre-pregnancy counseling, and in our hospital we do have what is called as a pre-pregnancy conception package itself, where all the tests are done to look for any other abnormalities in the mother, and if she is a known diabetic, we make it mandatory that her sugars are well under control, only then they enter pregnancy. By that we can avoid most of the complications.